When moving a patient in bed, there are many things to consider, including how many caregivers should help and what equipment is required. This video will show one of the ways to do a two-person minimal assist side-to-side bed repositioning using 2 slider sheets. Before you move any patient, look at the patient's care plan or transfer logo to see if they need help, how many people are needed, and what kind of equipment to use. Before you begin, be sure to explain to the patient what you're doing and which way he or she will be moving. Move any cord or equipment out of the way. Be certain the bed is flat, the brakes are locked, and the bed height is adjusted to the top of the hip bones of the shorter worker. Lower the side rails. Start with one caregiver on each side of the bed. Place the slider sheets under the patient using the technique learned during your training. If the patient is on a soaker pad, make sure the slider sheets are under the soaker pad. If the sliders are not under the patient's feet, use an additional slider or gently slide the patient's leg toward the edge of the bed in the direction you're planning to move. Both caregivers should be facing each other in a wide walking stance, with feet at about a 90-degree angle to the bed. At this point, if the patient is able, have him or her cross their arms, tuck in their chin, and lift their head. If the patient is unable to take these actions, continue on with the repositioning. Next, each caregiver should take the power position, feet apart in wide walk stance, spine upright, hips and knees bent, elbows tucked in, shoulders slightly back, and abdominal muscles slightly contracted. One caregiver will pull, the other will push. The caregiver who's pulling should grasp the top slider sheet in line with the patient's hip and shoulders, keeping the wrists in a neutral position. The caregiver who's pushing should place one hand on the patient's hip, the other on the patient's shoulder. Now for the actual move. Make sure the patient and your fellow caregiver know what you are about to do. Then count down to the move. The caregivers slide the patient to the side of the bed by simultaneously shifting their body weight. The caregiver doing the pulling will shift from front leg to back leg, while the caregiver who is pushing will shift from back leg to front leg. As you both move, keep your spine upright, your elbows locked, and your shoulders back. Move slowly and smoothly. You may also have to repeat the movement more than once to get the patient in the proper position. Once positioned properly, make sure the patient is comfortable and remove the slider the way you learned in training. Remember, communication, the right equipment, and proper body mechanics will make repositioning easier for your patient and for yourselves. And if you're ever not sure about something, stop and ask, because asking questions will help put you in a better position to work safely. This video is not a replacement for hands-on training. There may be other ways to do this repositioning based on the patient's needs. If you are uncertain about any aspect of this or any type of transfer or repositioning, ask before you attempt.